Hi, Dr. Applin here, and today I want to talk briefly about physical therapy related to auto accidents. And, um, when we get patients in our office after an auto accident, a lot of times they come in with the expectation that the greater the speed of the accident, the greater the injury is. And that's actually very seldom the case. Even in very low speed car accidents, say maybe you're stopped at a stop sign or a stoplight, someone just comes up and bumps you from behind, you can still sustain a significant whiplash type injury. And the reason for that is that cars these days, they're actually meant to crumple or crumble up in high speed accidents, and that crumbling effect absorbs a lot of the impact of the accident. So in low speed accidents, you don't get that crumpling effect. And so all of the force from that accident is actually transmitted into your body and more specifically into your back and neck as you quickly go forward, and then your neck is whipped back again. And that's the basic definition of what a whiplash type injury is. It's just that fast forward motion and then fast backward motion after an accident. What this does is it puts significant strain on the muscles and it sprains the joints there. So no different than if you'd had a significant ankle sprain. You get swelling in the joints, you get muscle tenderness, you get muscle tightness, and it can be very painful. And no different than if you had a significant ankle sprain, the best thing you can do right away is rest, just to reduce some of that inflammation. But we do usually like to start with treatment within a week or so after an accident. Sooner if there's not a lot of inflammation, but that's what we shoot for within a couple weeks of the actual accident. And our goals with treatment are going to be to massage out those sore points in the muscles, to improve or stretch out the muscles to improve flexibility. Once again, mobilize the joints in the neck or back, to improve the joint mobility. And because of all these things, after you have an injury like whiplash, it causes some weakness, instability in those joints. And so the final phase of treatment will be to prescribe some specific rehabilitative exercises to stabilize the joint once again. And I know I've been talking a lot about neck and back issues because after an auto accident, that's what we see most people come into our office with. But quite often, there's smaller secondary complaints. Wrist, elbow, or shoulder pain, which can be caused just by gripping the steering wheel. When you're in the accident, we see knee pain from people who actually jam their knee against the steering wheel or into the dashboard, and ankle pain just from pushing down on the pedal. When you're hit, you can jam your foot down into the pedal, and that can cause pain. So it's a lot of different areas of the body that can be injured during an auto accident. And we start by taking a full history and evaluation and figuring out exactly where those symptoms are presenting, and figure out the best plan for treating them all effectively. So hope this article is very helpful, and thank you very much.